going to be in prone for our gravity eliminated position. So there's a couple options when we think about working with the triceps, and there's a few different options that you could put your patient into if they weren't able to go into prone, if they weren't able to do some of these movements. And that's true, like we've said, with any of these, right? You can, you know, think about those planes of movement, like we talked about in the PowerPoint. Think about those planes of movement. What plane would I need to put my patient into? Most of your patients, they're not going to be this mobile. They're not going to be able to move in and out of all of these positions. A lot of times, prone is a very hard position to put your patients into. So I actually very rarely, in the settings that I've talked about, like an acute care setting, inpatient rehab, skilled nursing facility, home health care, some outpatient, if it's not specifically hands, this would be very difficult to move my patients in and out of a lot of these positions. Oh look, I almost put elbow triceps. So Trombley actually has us with the arm AB ducted away. Yep. So I would probably have my patient move, scoot more to your right so it's supported. And again, if I needed to with some of these, you know, just to kind of go back to skills and procedure and some problem solving, if I felt like this wasn't at a level surface, I would use some towel rolls right now, you know, do some different things in clinics. I could get that pure extension and isolate that muscle. So here, we're going against gravity, elbow extension against gravity. My stabilizing arm is going to be either here at the scapula on the trunk, or if I feel like I can, I'm going to come to the distal end of the elbow. And then my moving, the arm that's going to apply resistance will be at the distal end of the forearm. All right? Good. And again. All right, go ahead and sit up. Another position that I've used before for elbow extension, checking against gravity, maybe with the arm up here. And now we have to do extension against gravity. Of course, this means, you know, is the patient stable in their shoulder complex? Can they raise their arm up that high? Pain-free in order for me to test this. But this would be an alternate testing position that I use probably more frequently than the prone. All right, raise your arm up, don't let me push it down. Good. You do need to make sure that their trunk is support. If they don't have good trunk control, that could skew it and they wouldn't be able to fully do this position, right? For a gravity eliminated position, I'm going to come back here. And here is my gravity eliminated position. Same hand placement. I will support this, the extremity. I'm going to support the arm here, and if I need to apply that resistance, I'm going to come back to that distal end of the forearm. So fine. Kinesthetically for me, your hands can be, when they're giving you that resistance, then you have to give resistance back here, so you kind of need to be careful with that. That's why a lot of times I, you know, go back to that, push against my hand here, and really try to keep this other hand as a stabilizer, not as a resistance, right? I'm not trying to pull her back. Okay.